Sound Off Show. My name is Linda Kirker. I host the program, and thank you so much for joining us tonight. I really appreciate it when you do that. And I hope it's a regular thing for you, like it's a regular thing for me. By the way, I wanted to mention, here we are approaching the Christmas holiday, and therefore I'm wearing red, my favorite color. And on Sunday evening, I attended the Christmas concert at the Congregational Church. It's pretty much an annual thing with the community chorus and the community concert band. And it was phenomenal. Just what the doctor ordered. It was so upbeat. The band just, oh, they're phenomenal. And if you missed it, that's, that's too unfortunate. But I hope that next year that you will make it a point to go to that, because it's free unless you would like to make a small donation. And it just lifted my spirit so much. And I know other people who felt the same way. So I just wanted to put that bee in your bonnet for next year. One thing I wanted to read, this came to me in the mail, and Newt Gingrich wrote a book, or it's a DVD, Rediscovering God in America. And I love this. The next time someone tells you that God doesn't belong in the public square, join Newt Gingrich on a breathtaking walking tour with his video. It is just a wonderful thing, and I think I brought the wrong thing with me. But anyway, God does belong in the public square, and we need to have our young people learning to say the Pledge to the American flag in school every day. And I know it may be happening in some schools, but I also know there are other schools where that is not occurring on a daily basis. When I was young, and granted that was many years ago, but it was a good thing. And we said the Pledge to the flag every morning. We also said a prayer, the Lord's Prayer, in the classroom. And unfortunately, in today's world, there are those who want to take God out of the pledge and off of our money and so forth. And frankly, we need to step up, stand up, speak out, and not let that happen, and teach our children about respecting our flag and so forth. So that's my little opener. Has nothing to do with the topic for tonight's conversation. I want to now introduce my guest on tonight's show, Dr. Taylor Yates. First timer on the show.
Certainly am, yes.
Thank you for joining me tonight. I appreciate it.
It's my pleasure, Linda.
Well, I see you now and then, and we have our little chats.
We certainly do. I'm not sure they're so little.
No, they're not. They could go on for at length.
That's true.
But there isn't always the time that it would take to do that, but it's always a pleasure. And so tonight, why don't for those of you who might not know you, certainly a lot of people in this area would, because of you being a pediatrician in this city for so many years, why don't you just tell us your story, how you got into medicine and whatever you'd like to share, where you grew up, and just a little history of Taylor Yates.
Well, it's a little bit long, but basically...
Go for it.
Growing up, my nickname was Doc.
No kidding.
And the reason it was Doc was because my father was a physician. He was a pediatrician. And I'm a junior, so when I left the hospital, the nurses at the hospital called me Little Doc, and my father Big Doc.
Oh.
So therefore, my father was Dr. Yates, and I was Doc. And I was Doc until I got to my senior year in high school, and the principal of the school told me I had to change my name because there was no way I could go to medical school and still have Doc as my nickname, because by that time if every time somebody said Doc, I'd be turning around to see who was calling me.
Sure.
And so I changed it to Taylor, and that's why I go by my middle name.
Oh, that's good
Taylor.
to know.
And finished the University of Virginia, and then went on to medical school at the Medical College of Virginia, which is in Richmond, and finished it there in 1969.
Okay.
And when I finished medical school, I did what they call a straight pediatric internship, which means I went straight into pediatrics right out of medical school and into training. After 1 year at the Medical College of Virginia in pediatrics, I then went to my residency and fellowship in pediatric and adolescent medicine at St. Christopher's Hospital for Children up in Philadelphia.
Oh my.
The reason for that was twofold. Okay,
Yeah.
I had met my wife as a third-year medical student at St. Christopher's because her father was there as a chief of pediatric cardiology.
No kidding.
And so I always kid people and say this was an arranged thing because my father took me to St. Chris to introduce me to St. Christopher's in the hospital, and we met. First person I met at the hospital was Dr. Wells, who was what became my future father-in-law.
Oh my goodness.
And then long story short, we dated through my fourth year, and then in our internship, my internship, we got married. And then I went back up to Philadelphia, and we stayed there for 2 years before going into the United States Navy. And I was in
Yay, thank you.
I was in the Navy from 72 to 74.
Good for you.
And then after I was released from the Navy, I went to work with my father down in Alexandria, Virginia, because he was a pediatrician still. And I worked with him for 2 years, and I was expecting the practice to expand, and he liked it as a family practice, and I couldn't see any more Yateses coming along, so I told him that I had to move on to where I could find another practice. And so when I got a call from a physician here in town that Dr. Howard was retiring.
I remember him.
Dr. Samuel Howard retired in 1976, and I came in July of 1976 up here to St. Albans. So I've been here, and I practiced for 40 years as a pediatrician here.
Wow.
And retired in 2016. So I've now had 1 year of retirement. So
Well,
that's
welcome to my world. Well, that's quite an interesting story. I didn't know that you and Marcia met that way. You never know. That was meant to be.
Well, it was meant to be that we were supposed to be up here, because when I came up here, I was shown Dr. Howard's practice, and
I remember right where you were.
And within with a matter of, I came on a Monday, and by the time we left town, I had not only an office that had to be rebuilt, the Healds, Papa Heald rebuilt my building.
No kidding.
And made it so that we could have an apartment over top of it for Marcia, and I at that time had 2 children. Laura and Randy, and then we stayed there for 2 years before we bought the Piesner house on North Main Street, and we lived in the oldest house in town for many years. but I had an office building, I had an accountant, I had a bank, and I went to the People's Trust Company and told them I was going to set up a practice, and Don Poirier at that time said, just tell us what you need, we'll get it for you. And that was in the old days when a handshake meant something. People's Trust Company has always been nice to me. Sorry about the promotion here.
It's about trust.
Yes.
People trusting the people, right? Well, good for you, you know, and I can't imagine, Taylor, how many children you have seen through the years.
I meet them, I still meet the children.
Sure you do.
And their parents. And as a matter of fact, today one parent came up and told me she missed me. And I said, I miss the parents, the good parents, and I miss them because when you'd ask them to do something, they did it. And then I miss the children because the children were so much fun.
Yeah. Well, you bring up a point when you say the good parents, the ones who, follow through for the best interest of their children.
What happens is I think many times the parents don't know what is good and what is bad, and sometimes they listen to the wrong people.
Well, that's true. And unfortunately, today we have a lot of, shall I say, dysfunctional families, and very sad for everybody involved.
Well, I think if we could put the family back together again, both parents. My job was always easier as a physician when there were two parents, because that means that one parent wasn't going to be up all night and then be able to not take care of the child the next day.
Sure.
Because there was somebody who was going to spell them if there were two parents.
Sure. Well, there are a lot of good reasons for having two parents, but that's one of them. And from a medical perspective, and for the best interest of the child,
Sure.
as well as the family. Well, hopefully, we might have to pray a lot about this, but hopefully we can restore the family. And because what is that? That's the foundation of our society.
Certainly is.
That and the Constitution. I can't leave that out. But now you've been in practice for 40 years. What have you seen in the way that medicine overall has changed?
Well, we all know the cost of health care has gone up. You and I were talking before it started that when I opened the practice here, I asked my nurse, Sissy Reynolds, how much I should charge for an office visit, and she said, well, Dr. Howard was charging $5 an office visit, and if you saw him after hours, you paid $8 for an office visit. And I told her that I was going to have to charge a little more than $5, and she said, you can set it anything you want, but don't change it all the time. And I listened to Sissy because Sissy knew everybody in town.
Sure.
And so I set mine at $8, and she said, why'd you pick $8? And that's what the stamp was at that time. And so I put it there, and knowing nothing about the finances of medicine other than what I had learned with my father.
It was 8 cents for a stamp?
8 cents.
Yeah, so, okay.
So then I learned a lot about economics. And what happens is that health care, with my father, when I practiced with my dad, first of all, let's go back. When I practiced with the United States Navy, there was no fee. Everybody was taken care of because that was part of your benefits when you served our country, is that you had a physician, and it was paid for. And the one thing that people don't realize is that somebody paid that bill for those people.
Of course.
And so we understand that. And oh, by the way, the United States Navy, I didn't have to have malpractice insurance, because if you wanted to sue me, you had to ask my commanding officer for his permission to sue me. And if he didn't want to give it to you, then you had to go to the Secretary of Navy. If he didn't give it to you, you had to go to the Secretary of Defense. And if he didn't give it to you, you had to ask the President if you could sue me.
Oh, my goodness.
So we didn't have that. And I think people ought to remember that if we go to a single payer system in this state, is that then you will be working for the state of Vermont. If you work for the state of Vermont, now, I think there are physicians that are probably going to say that's the same thing as being in the military. We'll no longer have malpractice insurance. And that will open a ball of worms.
Whoa. Well, I'm glad you brought that up, Taylor. The single payer system, as I understand it, I recall that Governor Shumlin, prior Governor Shumlin, petitioned, I don't know if it was CMS or the government anyway, to allow our state to, in my own words, control Medicare, have Medicare be a part of our all-payer system or single-payer system. And I reject that wholeheartedly.
Well, now that I'm on Medicare, I agree with you.
You didn't before?
Oh, well, no. What happens is that people have to understand that if the state of Vermont wants to be a guinea pig and take on this expensive way of paying for health care, they're going to have to try to claw back all the money that's spent in the state. Now, if they came to me and said to me, I want you to participate in this system, in other words, as a patient, I'd say, no, I travel around the country. I don't want to have rather than having my Medicare card, have a green and gold card that says, when I show it to a hospital in Florida or into Arizona, and they say, well, tell you what, we don't, you give us your credit card, you pay us that way and you collect it from them. No, I like it the way it is.
It's a federal system, Medicare, that, as you say, your card is good around the country.
It certainly is.
Whereas who's going to trust a small state like Vermont's healthcare system? Besides that, I believe Vermont is the only or one of the few states pushing to do this. It's like we want to be first again.
This is one time that I would say it's a good idea to see how the system works before you put all your eggs in one basket. Because one payer means there's going to be one person that has control of the whole healthcare system, or one team that has the, and I'm not sure if that team is the medical center in Burlington or Dartmouth, because I don't know whether the state of Vermont's big enough to handle it by themselves. They may have to go to Dartmouth or to the state of New Hampshire and tie them together, and then we won't know who's controlling it. And so they can say that they understand where it's going to go. Now, I think people ought to understand I'm not against a single-payer, private single-payer insurance company, not a board that's appointed by a governor that has no physicians on it right now. Is that what happens is I don't know if people remember, there was a senator here named John Finn.
Yes.
And John Finn and I worked on a bill to have a single payer in the state of Vermont many, many years ago. Okay?
And what did that mean to you then?
Well, what happens, that meant that at that time we had 60 different insurance companies my staff was billing from around the country. And so John said, what can we do to keep the cost of health care down? And because I could see it was starting to rise. I said, why don't we go with a single insurance company in the state of Vermont? Because the state of Vermont's, it's really all the people in the state of Vermont are really not more than a small city in some other states. And so if that's the case, one insurance company could handle that. And I suggested to John, why don't we have a cafeteria-style plans with one insurance company, and if people at that time wanted a $2,000 deductible policy, they can have it. If they want a complete pay, they can have that. But they could select up and down this cafeteria as to what they wanted from one insurance company, and the policies will all be in English so people understood them. Okay, so what then happened is that I told John, I said, if we put this out to bid, the insurance companies out there are going to know that they're going to get all the healthy people as well as all the sick people in the state. And they might bid a little bit higher the first time, but after the first term, and John and I had set this bill up to say that we'd put it out for bids, one insurance company would get all of the health care in the state of Vermont for 3 years. And at the end of 2 years, we would put it out to bid again for the next 3 years. Okay? And by that time, the first companies would have had a track record, and they would have made more money than they expected because they would have all the healthy people in there. Okay? Now, what happens is that when John put this forward, the insurance companies around the state of Vermont gave him a very hard time. No sleep for 36 hours, and he said, Taylor, I have to pull the bill because I'm not getting any sleep. These insurance companies are saying I'm putting them out of business.
I believe that.
But what happens is, I said to John, just remember what we discussed, is that how many people get to build the bridge in the state of Vermont. The contracts go out, whoever wins the contract builds the bridge. When it comes time for the next contract, then the other people bid better to get the business.
Well, I understand that concept for some things, but I think when you're dealing with the lives of every individual in the state,
Yep.
I'm a free choice person.
But I think that you were given the choice. You could choose any doctor you wanted. You could choose any health insurance plan you wanted. With this one company, would handle all the different types of policies that you wanted.
But that company could decide what it was going to charge for each one of these policies.
But that's for a 3-year period. In other words, your health care would be stabilized for 3 years. And at the end of 3 years, because that company had made more money than they had expected to make, they would have come in with a lesser bid to get the next 3 years. And the other companies would come in lower too. So it would have been a free enterprise system. And that's what I was pushing for with John. Not a government-run system.
You say so. I would prefer to have several companies to choose from. Then you set up competition.
No, you're the first one.
Competition between them. Why are we hearing the phone?
Yeah.
I don't know. But anyway, I was thinking about, as you were speaking, the Medicaid population has grown from 2007, when it was 56 to 60,000 approximate number of people on Medicaid. Today it's 205,000. Oh, we have a caller. Welcome to the program, caller. What's on your mind tonight?
Well, first of all, I want to say, Linda, that you've got a good guest on there, Dr. Yates. He took care of my children and my step-children, and he is well respected in the area.
Thank you.
I'm certain of that.
And what I'd like to talk about right now is the health insurance that we got in Vermont, which is basically Blue Cross and MVP. They control the prices in this area where, you know, you've got no choice. Before, like you were talking, Dr. Yates, about the more the insurance companies, the better selection you would get, the better competitive rates you would get. But now with just 2 insurance companies in the state of Vermont, it's kind of crazy that, with the insurance prices.
Well, I hear what you're saying, but one thing you have to realize that we really have 4 insurance companies. We have Medicaid, we have Medicare, and we have the 2 private insurance companies. And I think what happens is, had Medicaid and Medicare paid their fair share right from the beginning, and the cost wasn't shifted over to the private insurance companies, the whole cost of health care would have been lower. And so people that have to buy health insurance, they have been subsidizing the federal government and the Medicaid and Medicare programs.
Dave?
Yeah, turn down.
Yeah, because we're hearing your TV. Okay.
I agree with you, Dr. Yates. Right down in Washington right now, I think we ought to take them, fire them all, and start all over again, because they don't know what they're trying to do, even with our national budget or with the health insurance. Giving these breaks to all the rich and not the people that are the working people of the United States. To me, everybody should get a tax break, but not more for the filthy rich and the middle income, which keeps this country going. And I feel that health insurance should be a right for everybody to have. You're also going to have to pay into it, but we need to keep it under control. Right now, I have to have a supplement that just went up $20 more a month. Plus, I have my Medicare. Plus, my prescription plan just went up $26 more a month. And I'm getting maybe a 2% increase in my Social Security. But then after they take Medicare out, I'll probably be in the hole again. So I'll have to work the rest of my life and be out there on the corner panhandling for money so I can retire.
No, hopefully that's not going to be the case, because I would hope that sooner or later reality would come forward. What happens is that healthcare is not being treated in the free enterprise system like it used to be. And they're talking now about going to a single payer system. And if they go to a single payer system, they will want to pay me for performance rather than for seeing the patient. In other words, if I keep you well and you don't have to go to the hospital and you don't have to use hospital facilities, I've done my job of keeping you well. Okay, what happens is that sounds like a great idea if you do what I tell you to do. If you don't do what I tell you to do and you get sick, then what happens is I get penalized as a physician for not keeping you away from the healthcare facility. The other day I was walking with another retired physician, and I asked him how many patients he saw on an average day in his office when he was practicing. And he said somewhere between 35 and 45 patients a day.
Wow.
Okay? And
Yeah.
I asked him how many patients do you think the physicians are seeing today? And he said somewhere between 15 and 20 to 25 maximum. And I told him that on my busiest day when I was practicing, I saw 86 patients. And that was not a 9 to 5 day. I started early at 8 o'clock and I finished at 10:30 that night.
Wow.
And what happens is, what is the motivation for the physicians today to work those hours if they're not going to be paid for seeing the patient, but for having kept them well? Because some of those patients had to get studies done, I would not have been paid for them because I didn't keep them well. Therefore, the incentive right now, if people want to talk about health care, it's not going to be the way it was when my father was practicing as a pediatrician, my father-in-law, and Dr. Howard, certainly, is that we had people that understood, I guess, quality of care. And so that's the only thing I can say is if you treat health care like you treat any other industry, that would be okay. I mean, if I was a car dealer and I sold more cars, you would applaud and say, "Oh, good, my
Sales
record's gone up. Therefore, I should be complimented." But if I now see more patients and have sicker patients and they have to go to the hospital, I'm going to be penalized. And I don't think that's good quality care. You can't compare, medicine in a different way than you compare other industry. That's not free enterprise.
Yeah, well, our new hospital we got up here, there's probably, 4 doctors and all the other ones are physician assistants?
No, I think we have a lot of quality physicians in our hospital staff. I can tell you that I feel very comfortable that the people of Franklin County have a quality hospital there. It's not necessarily going to be an inexpensive one because we have to pay for the bills that have now been accumulated. But I think that you do have good physicians in this community, and you're right, there are a lot of physician assistants.
Yeah. Well, thank you very much, Dr. Yates. I'll get off and give somebody else a chance. I wanted to start the calls to come in.
Well, thanks for calling. A lot of things. There was a meeting at the University of Vermont, probably 9 months, maybe a year ago. Al Gobel, the chairman of the
Green Mountain Board.
Green Mountain Care Board, the Governor Shumlin was there, and there were a number of other folks there. And the topic came up about doctors being paid according to the patient outcomes.
Right.
Well, I couldn't help myself. My hand went up, having been a nurse and knowing what it's like myself to go to the doctors. And I said, I must say that it is rather absurd. I just say what needs to be said, that, that a doctor could be held accountable for what a patient does after they leave his office. He can guide, he can have tests done, he can send them to a physical therapist or whatever it might be, put them, say, you need to see a dietitian, whatever it might be. But if the patient doesn't do it, how on earth can you hold the doctor accountable for that? That just does not make an ounce of sense.
I think they still are working that out. But I hope they're working that out because, if somebody's overweight and they're going to be type 2 diabetes, if you tell them to lose weight and they still become type 2 diabetic, you get penalized as a physician, that's wrong. There's just no way. I mean, I guess what's good for the goose is good for the gander. If they're going to restrict physicians and healthcare providers in this payment system, then the patients have to be held responsible too.
How can they do that? Just say you have no more insurance because you're not minding?
Your insurance is going to cost more.
Oh, okay. All right. Well, personal experience that I've had, 2 of them recently.
Yeah.
My doctor shall remain nameless, not in Franklin County, by the way. I went to see my doctor, and I, being who I am, I go in with my list of questions.
Sure.
And about things that I'm concerned about or wondering about. And I start talking about them, and she says, "Let me see your list." So she looks down my list and she says, "You're going to have to set some priorities. I have patients waiting." Okay? You get your 15-minute block. You get a bill for $169 or $196, I can't remember which. And you know, you see that on your statement when you get it from the insurance company, and I'm saying, what? What? That kind of cost? I couldn't believe it. The other thing is, I got a referral in August, toward the end of August, I got a referral to a specialist. Well, the appointment is in December.
Hope it wasn't serious.
Pardon me?
Hope it wasn't serious.
It all depends on who you are and what your opinion is. I hope it's not serious. Let's put it that way. I'm not certain right now. So, and I even called the doctor's office that I was referred to and to have them put me on a waiting list. Oh, well, we'll put you on the list, but we're booked way out, you know. So that's how things are going now.
Well, we didn't, in my practice when I was practicing, we didn't have come in 3 days later for a cold. You were seen the day that you needed to be seen. And all that meant was we worked longer to see them. And if these physicians that have 3-month waiting lists just realized, or if their administrators realized that all they needed to do was work a little bit longer for a couple of days, catch up, and then shorten that waiting list, that's the way healthcare should be delivered.
Will the current system allow for that?
Well, that's up to the physician. What happens is many of these physicians, I'll try to defend some of them, they don't know what their office staff is doing. They don't know how the office staff is booking. And because they come in and they go, they see their patients, okay?
But they must have a standard.
Well, you know, what happens is many times the office staff wants to get out at 5 o'clock. They're going to get out at 5 o'clock, and that's the name of the game. And I was lucky. The nurses that I had working with me, the years that I had nurses with me, and my wife did the same thing, is we stayed and we saw the patients until they had to be seen. And I was on call 24 hours a day, 7 days a week. So,
you know, this makes me think of another thing that goes way back to my childhood, and that's way back.
Yep.
But I remember going to see a doctor, my mom and I, and when the visit was over, my mom was given a bill, and she paid the bill. I think they probably had catastrophic insurance, and then when they went for more minor things, they paid the bill. Or people could do this. They could barter with the doctor. I have, you know, I'm a farmer, and I have eggs all year long. I'd like to barter with you, Doc. Or I'd like to do your yard work for you, or something as a fair trade.
You could do that when medicine was treated as free enterprise, but once the insurance companies started to come on, if you agreed to the insurance companies and Medicaid's you signed up to play their game, is that you could not treat one patient differently than you treated another. So if you accepted eggs and from one patient, you had to accept eggs from other patients. And so you had to treat everybody the same. Everybody was charged the same. When I know that and I probably could get in trouble, but I never charged physicians' families for taking care of them, because that's part of the Hippocratic Oath. We're supposed to take care of our brothers.
Mm-hmm.
And so that when that changed, when the insurance companies came to me and said, no, you have to start charging them, okay?
Mm-hmm.
And I could charge them, I didn't have to collect
Whose
it.
business was it?
No, the insurance companies said everybody had to be treated absolutely equal.
So
now
you-
that they didn't pay equal, but they wanted everybody treated equal, and that's part of
Okay,
how
but
medicine was
whose-
treated
whose-
differently.
Whose business was this?
Well, you know,
I'm talking, you're the business owner.
That's right. I stayed independent for many years simply because that was the way I was trained, my father, etc. Is that I remember when CHP came across the lake, and they wanted to have prepaid plans in the state of Vermont, and they requested me to join their stable of physicians so that they would pay me for a group of patients they wanted to give me, and then I'd get a stipend every month for these patients that were in, quote, my stable. What happens is that I turned them down, and I told them that I wouldn't accept their plan. And they said, why not? Other doctors, everybody else in Franklin County is joining up. And I said, I'm sorry. I said, that's not the way I do business, okay?
Good
And
for you.
they asked me why. And it was really kind of comical, a little bit comical, because Robert E. Lee, General Robert E. Lee, is one of my relatives, and I had a picture of General Robert E. Lee over top of my mantelpiece for the 40 years I practiced. As a matter of fact, General Lee is still with me in my house. Is that General Lee, when the Civil War was over, was offered a position with the insurance company of the South, and they wanted his name, so they were going to change the name of the insurance company from the Insurance Company of the South to the General Robert E. Lee Insurance
Oh,
Company
yeah.
of the South. So after the war, everybody would have been buying their insurance from General Robert E. Lee's insurance company if you were from the South. Now, what happens is that Robert E. Lee asked what he had to do for this stipend they wanted to pay him. As a matter of fact, they wanted to pay him $80,000 a year, which is a lot of money back
In
then.
those days, yeah.
And he asked them what he had to do, and they said, we just want your name. You don't have to do anything. And his comment to the insurance company at that time was, I don't receive wages for services I don't deliver. So he turned them down and went to Washington University, which became Washington and Lee. At that time, when CHP representative was in my office, I pointed to General Lee and I said, his statement was, I don't receive wages for services that I don't render. Mm-hmm. And I said, you're asking me to get paid for services I don't render. And I said, I'm not going to do that because I think that's bad health care.
Good for you.
And
Well, you must have been thrilled when they took down the statue, didn't they, of Robert E. Lee?
well, some of us were a little upset about that.
I
I don't
would
think you
think
can
so.
change history. History is history. And I asked many people when children were having troubles with their parents, I asked them to do me a favor, go outside and throw a rock up in the air and let the rock hit the ground. When the rock hits the ground, tell me what one thing you can change that happened before the rock hit the ground now. And the answer is nothing. Only thing you can do is move forward. If we don't learn from history, we're going to be in big problems in this country.
And you know,
I don't defend all of history, but I'm going to tell you, we have to learn from history.
well, yes, you know, this country makes mistakes. But we've rectified some of those mistakes as we've gone forward. And I think many countries do not rectify their errors, and they let them go on forever. And I think we can be proud that we're the type of country that can address the mistakes we've made and try to make things better.
Yes.
So I was upset, and I'm not a relative of Robert E. Lee, but that's part of our nation's history.
Great. It absolutely is.
and we learn from our history, or hopefully we learn from our history. Anyway, excuse me. So let's see, what else did I have on my list of things? If you think of something else you want to pop up with, you just go right ahead, because I'm a paper person.
Oh, no. I forgot to say thank you to the caller that called in for giving me the honor of taking care of his children.
Oh,
Thank you.
you know, yes, and it's such a huge responsibility to, you know, it's not just putting a Band-Aid on a wound. It's caring for the individual. It's just like I felt as a nurse when I worked in the hospital. I got frustrated after several years because we had a 49-bed unit with orthopedics and ophthalmology, and we had, the first year I graduated, we had, oh, we have another caller. Okay, I'm going to stop right there. Caller, welcome to the show. What's on your mind?
Hello. Good evening.
Hi.
You sound a little bit removed, but I think that's just the sound system. I've been watching and enjoying the show very much.
Thank you.
I find the information very valuable and enlightening.
Good.
So I guess my bugaboo is, or what I would like the good doctor to give his opinion on, we have a 5-member board, healthcare board
Yes.
in Vermont.
Yes, ma'am.
And none of those appointed positions
Well,
involve a physician.
yes.
And somehow that strikes me as being not quite right.
Well, I was talking to Linda earlier, and I said, I wonder how many banks would like to have physicians running them and have no accountants or bankers on their boards. And I think that if healthcare, if people step back and start treating healthcare what it is a profession. It is not a business. And if people start realizing that the profession of medicine should be treated that way, we would have physicians on that board. I'm not sure that board's needed, by the way.
I agree with that. And the thing is, what's happening is that this board and the certificate of need, all of these government controlling aspects of healthcare take away a lot of the really positive things about doctors and nurses providing care.
Yeah, well, Linda, you and I talk about the Constitution frequently.
Yes, we do.
And the Constitution was set up to have limited government. And when we expand the government, as we have done with health care, we can see what happens. When they expanded into Medicaid and Medicare, didn't pay their fair share, then somebody else has to pick it up, and that was the private payers or the insurance companies. And that's why I say we have to go back and realize that the government is really responsible for the cost of health care going up.
As I agree with you, and I feel the same way about education, there is nothing in the United States Constitution that gives the federal government the power or authority over health care or education. And yet government has its hands all over it.
Yeah. Well, I agree people deserve care, and if they need care. As a matter of fact, I said for the 40 years I was in practice here in the state of Vermont, if you can show me one person that needed care in Franklin County that didn't get it, let me know their names. Because for the 40 years that I practiced, people in Franklin County could get health care. It might be expensive, they can get health care. So health care is available. Now, I'm not sure, I apologize to Linda for a physician not wanting to see her for 3 months. But I believe that all of that, if you go back and start treating physicians with the respect that they were given in the past, I think you could see that change.
Okay, maybe the patients give them the respect, but the system doesn't.
No, that's a problem.
Yes. Thank you for calling in.
Okay, thank you.
You're welcome.
Thank you.
What was the other thing? Oh, no, it was about the Constitution. It was something I wanted to say, which is escaping me at the moment.
Certificate of need? You and I were talking about that.
Let's talk about that. Go ahead.
Well, I think what happens is once again, that goes back to free enterprise. And the certificate of need, I can see how the government might want to control how many different, so let's say that you wanted to take care of cataracts and you didn't want to take care of them in the hospital, and you had the ability to take care of them out of the hospital, and it would be less expensive out of the hospital, and you wanted to set up a facility to do that, the certificate of need would restrict you from doing that. And I guess my statement is that if you want to keep the cost of health care down, you have to free up health care to keep the cost of health care down. And that's not necessarily done with the certificate of need as it is now implemented.
Absolutely. Here, I just found this. I printed out before I came to the show. Certificate of need. New health care projects in Vermont must obtain a certificate of need, otherwise known as a CON, from the Green Mountain Care Board prior to implementing their business. It's a 5-member board deciding what kind of health care and who can provide it in this state. The CON process is intended to prevent unnecessary duplication of healthcare facilities and services. In other words, choice for patients. Guide their establishment in order to best serve public needs, promote, who decides what the public needs are, promote cost containment, that's an interesting one, and ensure the provision and equitable allocation of high-quality healthcare services and resources to all Vermonters. Now, did I say, I was going to mention, did I say how many Medicaid patients?
No, the number has gone up, but I think what happens is, let's go stick with certificate of need. I believe we're the only state in the union now that requires this in health care. And so that therefore free enterprise in the state of Vermont is even squashed further than other states.
Why are we so concerned with control?
Because that's the way the government runs.
Yeah, and the more control, when I spoke to the 7th and 8th graders at the school, I said the bigger government gets and the more control it takes, the less free you are as a citizen.
Well, as Ronald Reagan said, the nearest thing to perpetual motion is any government program.
He had some whoppers, some good ones right on target. But in 2007, Vermont had, I believe it was 65,000 Medicaid patients. Today, we have 205,000, or that's the last number that I've heard, one in 3.
Well, some of that is because of what Medicaid has been expanded to. Medicaid was originally to take care of health problems. Right now, Medicaid takes care of a lot more than health problems. A lot of the special education programs in the school systems are paid for by Medicaid.
That should not happen.
So what happens is that's part of the reason why the cost of health care went up. Because Medicaid went up, because they expanded into all these different areas. I mean, we could talk a long time about things that should be limited. Now, I don't want to take Medicaid away from the people that need it, but I'm not sure that we need to have 4 aides in a classroom when you have 12 students in the classroom and a teacher.
Absolutely. Like the good old days.
Sorry.
No, that's fine. When we were in school, 1 teacher, 25 students. No problems.
No.
If you
Because if you behaved in school, fine. If you misbehaved in school and went home, your mother said to you, why did you misbehave? It was not the other way around. I'm going to get even with the school. So you got to realize the parents are somewhat responsible for what's going on now.
Well, yes. If I were running a classroom, if I were the queen bee, which we all know I'm not, but if I were running a classroom, I have a friend whose daughter is a teacher, 5th grade teacher, and she laid the law down in a nice way the first day of school. Mm-hmm. Here are the rules. If you have a problem, you come to me and we'll work it out together. But there will be, you're not going to talk to one another when you're in the process of learning. All the rules of the classroom. If you have to use the restroom, you put your hand up and, I'll give you permission to leave the room. All of these little things, she's a phenomenal teacher. But God forbid today that you should tell somebody's child that they can't do X, Y, or Z, and then the parent, not all of them, of course, they're wonderful parents, but there are always the exceptions. When we were in school, if you shot a spitball across the room, yep, somebody grabbed you by the neck, or the teacher ushered you to the principal's office. Or you made an airplane, a paper airplane, and shot it across the room. I remember seeing that happen. It didn't happen a second time.
Yep.
Because there were rules, and they were enforced.
Right. Well, that was because the parents enforced the rules at home, just like the teachers did in school.
But because the parents don't do their job, perhaps, some of them, then it makes it more difficult for the schools, right?
Right.
So how did we get here? I just don't know how we got here. I liked it when I was in school. I loved school.
Well, I enjoyed school also.
Oh, yeah.
But remember in school, like in most of society then, as you said, we said the Pledge of Allegiance. We did have the 10 Commandments up there.
Yep, and we said a prayer.
And we said a prayer. And when we go back to the nostalgic days type thing, when you go back to the Declaration of Independence and say, we hold these truths to be self-evident. What happens is the majority of people understand the life, liberty, and pursuit of happiness. I hope they remember it's the pursuit of happiness, not the guarantee of happiness.
Absolutely.
But they forget the first part. We hold these truths to be self-evident. Now, where did these writers of the Constitution, by the way, Thomas Jefferson was one of my relatives too, and when he put the truths down there, he meant the truths from the Bible.
That's right.
And when we took the Bible out of the classroom, we took the 10 Commandments out of the classroom, this country started to deteriorate.
Yep.
And you can go back and say, oh, well, we can't reclaim it. Yes, we can.
Yes, we can, and we should.
And that's the name of the game.
And the churches need to step up and bring the people into the place where there's respect, and respect for religion, respect for the Constitution, the founding of this nation, one another, all kinds of things, the law. And respect for self.
Yep.
If
we respected ourselves, we'd take care of ourselves better.
Yes. Why don't we go out on the road? And I mean, it's so great to talk with young people. You really should. I don't want to be the only one. People need to get into the schools and talk with the young people. And I was talking with someone who's a lay pastor in some churches. And she told me that if you get 12 people there on a Sunday, that's something. What has happened?
Well, they can come to our church, Linda.
Oh, I know. The pews are pretty much full.
Yes.
Thankfully, thank God. So let me see. About Medicaid. Mm-hmm. I thought, well, part of the reason why we have so many more people on Medicaid was this agreement with the federal government, right? Mm-hmm. That we would expand, we got money.
Yeah, well, that's it. If you expanded your Medicaid program, then you got more money from the federal government, and you basically paid a little more, but you got so much more. And I forget the percentages. It may have been 30, 70%. But the state of Vermont had to come up with 30%, and the federal government would put in 70%. So if you increase the number of people on Medicaid, you would do that. And when they started to change the health care system, they then encouraged more Medicaid, so therefore people were dropping off of regular insurance because they could go over to Medicaid. And when they did that, then there was fewer people, the healthcare facilities were getting paid with the higher insurance companies' payments, and they had to make up with the lower Medicaid because there were more people on Medicaid. The government artificially shifted the environment,
and not for the better.
Some people say you can't go back. Somebody said that once the genie's out, you can't put him back in the bottle.
Well, maybe yes, maybe no, but we can go back in our minds to remember and respect our history. And when we see things that are not going right, then I believe we need to stand up and speak out. In fact, one of the things I've thought about, and this is a little off topic, but I'll get right off in a minute. My mind wanders. What would happen if the states got together and said, we're going to vote, I'm talking about the people in the state voting about federal spending, because we're headed toward $21 trillion in debt. What does that do? That makes this country vulnerable. We have countries that are not friends of ours who own part of our debt. And that is very, very scary. And the irresponsibility of spending on behalf of whatever special interest or what have you is not in the best interest of the people at large. And we, the people, in order to form a more perfect union, okay?
Right.
We're the ones who need to be stepping up, speaking out.
Well, you're right. It's the people are the ones responsible for this, and I would say to the people out there that are listening tonight on the topic of health care, is that you need to be informed about what one single payer is going to do to your health care and your children's health care. I have grandchildren in the state of Vermont, and I want the health care system to be a quality system for them.
Sure.
And I'm not sure it's going to be that way if the people don't speak up. And that means talk to your representatives and tell them that you're not in favor of this.
Well, we just had one call in. I didn't get a chance to identify her, but
Yeah.
Representative Gamache called in, and I appreciate that. Yep. And she said she was gaining information from you, so that's a good thing. But then again, you know what? How about you going down and testifying? I'll even go along with you. I'll keep quiet. You have to put a muzzle on me, but oh, down to 1 minute. Oh my goodness. Any parting thoughts?
No, I've had an enjoyable time talking to you, Linda.
Oh, me too. Thank you so much for coming on. I hope you'll come back, and we'll be talking again after church.
Yes.
Folks, thank you so much for tuning in. I hope you enjoyed the program. Next week will be a different topic, and I hope you have a great week ahead. Enjoy all the lights on the park in St. Albans. It's just beautiful.
Yes.
I came out of the Christmas concert the other night, and it was dark, and I looked at that and I said, oh my God, this is fantastic. So thanks again for tuning in. I'll see you next week. Have a great week. Good night.